Good afternoon, everyone. There is no financial interest. In developing countries, ocular injury is the most common cause of blindness following road traffic accidents. Ocular injury may involve eyelids, lacrimal canaliculi, orbital wall, periorbital structures, conjunctiva, cornea, sclera, extraocular muscles, vitreous and retina. There may be prolapse of uveal tissue, vitreous hemorrhage, choroidal hemorrhage, and globe rupture. These are the causes of visual loss. So, this study we analyze the different types of ocular injury following road traffic accidents and its management both medically and surgically in a tertiary hospital. This is a cross-sectional, non-interventional observational study. We included the patient of age group 10 to 70 years of age. Patients who sustained ocular injury following road traffic accidents are included in the study. Ocular injury due to domestic trauma, chemical burn, assaults are excluded from the study. The study period is of 1 year. Total number of patients were 146 patients. Ocular examination is done in 2 phases. First phase we did bedside examination, and second phase evaluation of patient is done in outpatient department once the patient was ambulatory. Bedside examination included extraocular injury assessment, pupillary response, vision by counting method technology, extraocular movement examination, visual field assessment by confrontation test, and fundus examination by indirect ophthalmoscopy. These are the cases where first case ecchymosis with subconjunctival hemorrhage we can see, second case both bilateral ecchymosis, and third is the lid tear. And these are the cases where we can find lid tear, subconj hemorrhage with corneal tear. This is the rupture globe, and here subconj hemorrhage, and here is the traumatic nerve palsy, and here is the traumatic endophthalmitis. So mainly males are more affected, and most common ocular finding is ecchymosis followed by subconjunctival hemorrhage. 30 to 40 years population are more common presentation, and two-wheelers are most in the risk group. There is 68% patient have influence of alcohol, and 36 patient they use helmet, and 64 patient they didn't use helmet. There is 8% they don't use seat belt in case of four-wheeler, and left eye involvement is more common in this study, and 42 patient they use mobile phone during driving. We manage ecchymosis, subconjunctival hemorrhage, and hyphema medically. Lid tear, corneal tear, and iris prolapse were repaired surgically, and there was a mutilated eye in which we did evisceration, and vision was not recovered in patient with traumatic optic neuropathy. So coming to discussion, in road traffic accident, ocular trauma is the major cause of ocular morbidity and blindness. Male patient with age group 30 to 40 years are the most common victim. Namala et al. In their study showed that two-wheeler riders are more prone for ocular injury, which is very similar to in our study. In other study, right eye involvement is more, but in our study, left eye involvement is more common. And this is the first study which shows the influence of mobile phone use during driving or riding, which is about 46% of cases. And the major cause of vision loss is about 7%, which is similar in other studies. To conclude my study, ocular injury are the most common cause of significant mortality following road traffic accident. Phone use, not following traffic rules, overspeeding, alcohol intake, not wearing protective gears are the major cause of ocular trauma. So awareness about the hazards of the road traffic accident and timely management of the injury can save sights. These are the reference. Thank you.
Did you do a BETS classification of the trauma?
Yes, sir.
Was it done, the BETS scoring? That is the classification system. You do the trauma scoring. Was the trauma scoring done in these cases?
No,
OTS,
Okay.
OTS scoring. What was the additional information in this studies you?
Sir, this is one part of our study. Another factors we considered the orbital floor fracture or any wall fracture of the orbit, and if it is associated with head injury or not. So this is one part of the study where we manage because when there is fracture of the orbit, we refer to the plastic surgery group. So we have not included that.
Actually, just documenting the use of helmets is not of any use because most people wear non-standardized, non-ISI helmets. Actually, you should include standardized protective wear and non-standardized. A lot of times the shield of the helmet itself, if it is non-standardized, can cause injury.
They can tear
itself.
the cornea also.
So that should have been documented actually.
Yes, sir. Thank
Also, the timing of the injury should also be documented. When you were saying alcohol intake before night time or daytime, that could have also been
you. Yes,
documented.
sir.